You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Kelly Holmes, and my preferred pronouns are she, her.
And I'm Lerenza Howard, and my preferred pronouns are also she, her.
Hi, Lerenza. How are you?
Hi, Kelly. I'm doing well. How about you?
I'm good, thanks. I'm super excited for our guests today. We're going to be talking about the Infection Preventionist Career Development and Advancement Guide, and we have two experts who really helped develop this project to talk to us today. And I'd like to first introduce Chris Zirges. Chris is the System Director of Infection Prevention for SSM Health. Professional endeavors include past board member of the Certification Board of Infection Control, which we all know and love as the CBIC, current chair of the APIC Professional Development Committee, board member of the Board of Directors for the Healthcare Laundry Accreditation Council and the HAI Advisory Council through the University of Missouri. She is certified in infection prevention, board certified as an advanced practice nurse, and a fellow of the Association for Professionals in Infection Control and Epidemiology. Her doctoral focus was on reducing the number of indwelling urinary catheter days. Chris's experience includes practicing infection prevention in many settings, which made integrating a corporate-wide program a natural next step. Her interests include standardization of work and sustainment of clinical interventions. The structure and processes of a high-functioning infection prevention and control program are a key driver of success. She is from Kirkwood, Missouri, and a proud parent of 2 young men.
And I have the honor of introducing our second guest. Angel Mueller is a certified infection preventionist and APIC fellow with over 16 years of progressive IPC and leadership experience. She is the system director of infection prevention at UnityPoint Health, where she provides leadership and strategic direction for multiple hospitals, ambulatory, and home care settings throughout Iowa, Western Illinois, and Southern Wisconsin. Angel was a member of the APIC Professional Development Committee for 6 years and served as chair of the committee for 2 of those years. Through her work on the Professional Development Committee, Angel contributed to the updated APIC IP competency model and was a participating author of the article introducing the model and helped develop the IP Career Development and Advancement Guide. Angel is knowledgeable in the IP competency domains, enjoys developing tools and systems to make IP processes more efficient and effective, and is passionate about advancing the profession and supporting the development of IPs throughout the world. Welcome, Chris and Angel.
Thank you so much for having us today. It is an honor to be here with you, Kelly and Lerenza.
Yes, thank you.
Absolutely. So first things first, and of course, this topic has been a buzz within our profession, right? Having that career ladder. What does that look like for us as IPs and IP leaders? So share with us, Angel, starting with you first, share additional insights on the development of the IP Career Development and Advancement Guide and, additional details on how you all formulated this tool.
Yes, I would love to. Well, the guide was really a long labor of love of the Professional Development Committee. It was about a 2.5-year project. And I want to pause and give a huge shout out and thank you to both the 2022 and 2023 PDC members because they were very integral in development of the guide as well. When we initially started this work, it started as a career ladder. We were going to put together a career ladder toolkit for organizations to use to help advance, the infection preventionist clinical ladder and careers within their programs. But as we got stakeholder input and did more research, this idea really grew and evolved beyond the career ladder. We recognized that we needed to be more inclusive of the expanding settings in which infection preventionists are working and the growing career stages as well for infection preventionists. We wanted to really emphasize the career path of the IP beyond just a career ladder within an organization, and really provide all of the tools and resources that an infection preventionist needs to plan and navigate their career path according to their own strengths and interests and what they plan for their career. This was really the first time that the terms career path were used officially and informally for infection preventionists. And so it was very clear as we worked on this project that we needed to encompass everything that we were finding, and that it really grew and developed into the guide that you see today.
Wow, that's awesome. Chris, share with us your insights related to the development of this tool.
Well, sure. To add on to what Angel was talking about, in the context, it did take 2.5 years, but a lot of thought and discernment went into developing, as we lovingly call the guide, that when we looked at not only the literature and actually the APIC mega survey, IPs were practicing just beyond that inpatient scope. So I believe it was in 2015, there was a survey where about 21% of IPs were working outside of the inpatient settings. 5 years later, that expanded closely to 57%. And so what we realized in the Professional Development Committee, or PDC, was that our tools and work should really be developed and focus on the IP regardless of practice setting. So in that 2.5 years, we were also looking at how do those skills translate regardless of the setting in which that IP practice is. So that was really quite a discernment process. And we had lots of meetings and even our own internal validation processes, because working with those different PDC members, as Angel alluded to, it wasn't just one committee that was point in time. There was natural turnover through attrition and transition on the PDC. And we somewhat cross-validated our work as members rotated off and came back on. So we thought, well, it does work well, that it speaks to IPs regardless of practice setting, but we had that internal reliability. Like, does this make sense? And we really came together as a group, like really, I think we nailed it. It does make sense. And another thing I will add on to what Angel spoke to is that we did have to pivot. So while there are career ladders, many organizations don't have career ladders, and there are some complexities to that. They cost money. You have to have a framework in place. Sometimes they're maybe a little bit difficult to manage. And so that is also why we built out the career stage and career paths that Angel alluded to. So it really was a novel approach, but in the context of all those other things that I just mentioned.
Yeah, and Chris, I'll just keep expanding on that too. I think one thing that we recognized as we spoke to additional stakeholders and the PDC members and realized is, like you said, a lot of IPs themselves don't have the ability to implement career ladders in their organizations. And so without having those career ladders, what can we provide to help those IPs? We know that every infection preventionist needs to grow and develop in their profession and to move through the career stages, regardless of having a career ladder in their organization. And so as this guide grew and developed, it's really providing the avenue for those IPs as well, and that framework for those IPs to grow and develop themselves personally and professionally, even if their organization does not have a career ladder.
That's right.
Oh, I love that. I love that. I know that, when you're starting as an infection preventionist, it can feel like you're jumping on a moving train. You're like, where am I? What am I doing?
Exactly.
So I love, the careful consideration that you gave to, creating basically a roadmap for people to identify with, okay, here is where I am at in my career stage. How can I, improve myself and expand on my learning to move to the next stage? So could you give us a little bit more of a breakdown on those new career stages that were added to this document?
Really, when we look at the career stage, and you're talking really about building out the bookends, Kelly, I think, is that what you're referring to?
Absolutely.
To the different roles? Yes.
Yes.
So traditionally with IPs, that those of us that have been around a while, or where we land on is that novice level, pre-proficient, proficient, and then you look at the expert or advanced IP. So there's somewhat of those 3, maybe 4 swim lanes for those career stages. What really is a very different approach that was well thought out, we believe, is that we added at the beginning a paraprofessional role or stage, and then on the opposite end, we have an IP leader and IP executive. So we've added really 3 additional swim lanes. And we really felt it made sense. When you look at the numbers that I referred to earlier, we also, in our introduction of the guide, have a nice little overview of the literature where you have the number of IPs that are retiring in upcoming years. I mean, our profession has had some challenges. Many IPs just naturally are going to age out. But we also had the pandemic, which was influencing turnover and early retirement, and there just wasn't the sheer numbers to backfill these roles. So based on all of these things that we mentioned, we thought, well, it makes sense to build in this paraprofessional. And exactly what is that? So this was a part that we really, when we were vetting this with other key stakeholders, we're going through like, does this make sense? And if you think about it, think in the pharmacy world, you have a pharmacy tech, and then you have pharmacist. You have a nursing tech, you have nursing, surgical tech, then you have your surgical professionals. So that is how we created this paraprofessional role. And we provide suggested job titles. When you look at the guide, there'll be suggested job titles that maybe you want to call it an infection prevention technician. Maybe it's an intern. Maybe you're somebody that might be a data analyst that's going to take on some of those components that we wrote into the sample job description. So while it allows that entry level, it also is a pipeline to help backfill that role. So perhaps there could be nursing students or students that are in a Master's of Public Health program that might have an interest in infection prevention. This is a perfect role for that, and that's how we designed it. And that individual would perform many of the infection prevention duties under the observation of the infection preventionist. And the let's bookend that with the back end is that we have IP leader and then we have an IP executive. So think of your IP leader, and these are people leaders of how we wrote these. The IP leader is one who leads the team. So that really could be a manager or a director at a regional level, or maybe in a large hospital system that they're taking on the people leader role. And then we have the executive IP that's leading the organization. And you think traditionally, we probably forgot about those folks, because being a people leader, you're kind of the super IP, but you're also taking on these leadership roles that has another entire set of competencies as dictated by your organization. So we've built out the stages. So we've kept the 3 that we're used to, but we've added that paraprofessional. And again, we have an IP leader and IP executive.
And Chris, I think that is great to note in culmination with the fact that, we have a profession, a gap within our profession in, hiring, as much as there are those that are either dropping off from the profession altogether and or those that are retiring out, to ensure that we remain consistent with the times. Of course, as we know, healthcare is an ever-changing field. And we see even over time how organizations are merging and are becoming larger. Therefore, it requires for certain roles, including IP, to shift and change and navigate that. What does that structure look like for an IP professional, and the necessity for a ladder, right? Because we have to institute measures for sustainability and then also marketability for the role as well.
Yeah, absolutely. And another benefit, I believe, to the way that we've designed this guide is that there might be leaders that many of us report to that may not really understand your role or the IP role. We may still have that in our profession because it could be maybe confusing to those that aren't really familiar with our profession. So the guide also helps to illustrate that, or what is an appropriate, perhaps, competency for these various stages. So I think that there's multiple uses of how the guide works, not only from that recruitment, but also outlining what those swim lanes are in each of those career stages, and provided are really the competencies related to each of those stages. As a guide, we have self-assessment tools, so one can assess themselves within that career stage, but they can also look ahead. Not all IPs perhaps want to be a people leader, but if they do, you can look ahead and see what perhaps are those competencies. Or, maybe I really want to be the best and most advanced IP I can be in my role of where I'm at in this, this clinic setting or within public health or in home health care. What do those advanced skills look like? So you can also look ahead and see what's around the bend in that next level of career stage. I don't know, Angel, if you wanted to add anything on, because we had quite a few discussions on these, didn't we?
Oh, yes, definitely. And I think that's really important to clarify is that, not every IP has the same desired career path. As we've noted, some, may want to be people leaders, and that's fantastic. And this guide helps to, like you said, lay out what they might look to work on to develop those people leading skills. But not everyone wants to be a people leader, or maybe even has that opportunity within their organization. But you can still advance and be an expert advanced infection preventionist, again, using the guide to outline what you need to grow and develop in the competencies to be an expert infection preventionist. So, this really is for everybody. I also think it's important to note that, there was a lot of intentional alignment with other work streams going on throughout APIC and the infection prevention profession as well. We've got the academic pathway, so that really is supported through this paraprofessional stage as well, bringing in those interns and apprenticeship programs to grow and develop new IPs before they really enter into, the career stage as a novice IP. And then, like you said, on that other bookend, the IP leaders and executive IP, it's really showing that our profession is elevated. We have really strong leadership roles in a lot of organizations that help to drive successful infection prevention and control outcomes in those organizations.
So you noted competency, correct? So let's delve deeper into the competency white paper. So share with listeners, how does the competency white paper complement the career development guide? And then the second question to that is, how can IPs leverage these tools to advocate for their career growth? Chris, I'll start with you.
Sure, thank you. So the competency white paper was a natural evolution of the work that we completed on the guide. And the objective of the white paper was really to define somewhat of the guardrails of what IP competency looks like. So while we updated the competency definition, the white paper spoke about the updated definition, but how do we as a profession manage our competencies? And there's really, if I speak to the three sections of the white paper, think of it this way. So one is, how are you structured in your organization to demonstrate compliance with competency assessment? So we know that there are regulatory requirements related to competency. So perhaps there's DMV, the Joint Commission, or CMS. Any of those regulatory bodies or perhaps state guidelines will have some language about requirements to job competency, not just in terms of your performance eval, but how you're demonstrating competency. So in the white paper, we outline that of how to manage that, how important it is to stay compliant with your job description. And this is a key point. If your job description indicates that you need a degree in nursing or related healthcare field in the job descriptions, then anyone hired in an infection preventionist job title should meet that title in the job description. Also, how do you follow your organizational policies? How do you keep that competency documents together? How are you able to speak to them? Who manages that in your organization? So think of it as what are those requirements, but how to package that up and administratively follow those. The second piece of it is talking about your career, managing your own competencies and your career portfolio. So how do I, in my role, track my competencies? Well, it's through managing my own self, but I'm attending certain courses. I've identified my learning needs. I've completed the competency tool that perhaps my department has required of me. And also I'm keeping track of my certification. So in the white paper, we talk about how do you manage a portfolio? And as we just talked about, that guide is the document. It's the toolkit that helps you do that. There's tools in there to help you do that. So while you manage your portfolio, and the other piece of it, and this was a significant discussion we had when we had really vetted this white paper amongst other groups, certification is not the end all be all with competency. It's just one credential. It's one step. So if you are certified in infection prevention, you still have to follow your organizational guidelines in terms of requirement for competency, but as an infection preventionist, what other competencies have you met? Perhaps it's you're being validated on surveillance. Perhaps there's performance improvement, objectives that you want to match. So whatever career stage you're in, that on our tools, there are competencies on there as how you're following the domains of the role. So it might be, can you demonstrate what performance improvement projects you facilitated? Have you engaged in implementing research? Have you developed a solution, maybe optimizing technology and how you utilize that domain of practice? So there are those elements, that skill sets that you should illustrate your competency thereof. The third section of that white paper talks about your interprofessional roles and clarity thereof. When you look at the literature on interprofessional collaboration, there are some organizations that actually have competency statements written to how well professionals exhibit behaviors related to interprofessional skills and how they work with teams and understand role clarity and how to optimize that in teams. And that has been shown in the literature to also have a positive impact on patient safety. So that's perfect for IP. That really fits right in. So the white paper, again, just goes through, how do you administratively comply with that in this regulatory space we're in? How do you manage it for yourself? What does my portfolio look like? And then the third piece is that role clarity piece. And we provide some really tables in there to help make those points clear.
Chris, and I think that you brought up a very important point that I wanted to pull out just to, implore IPs, because based on what you're noting, the tool is empowering the IP, right? To empowering them to take control over their career. There has to be that process whereby the IP themselves are managing their career and leveraging and utilizing these tools as they matriculate, and basically collect all of these competencies to bolster bolster their experience within the field. Because I think sometimes, you believe that you're depending on your leader to assist you in managing up or leverage or how should I say this, or in managing or guiding your career, I should say. If your desire is to be in leadership, some people may believe that it's their leader's responsibility to make sure that that happens. But from your purview and the purview of this guide, we really should take the approach of also managing our careers to ensure that we are growing within our profession as well.
You know what, and that is a key point. And I think sometimes, there is that natural, place to go that, okay, let me just meet these requirements. It's my annual review. Let me complete this. But you are right. It is incumbent upon us to manage this professionally. And the other element I'll add to that is our regulatory partners all have, jobs to do, right? There is a purpose that we have regulatory oversight in our industry. And I think what is important on this, another focus of that white paper, is how do you articulate that to if you are in a survey mode or when the IP quote file is pulled. Mm-hmm. And I have been in that seat many times. And I believe the paper also guides that conversation. No one knows our roles and competencies like we do. Mm-hmm. And we have to be able to understand it and speak to it. And otherwise, it could go down a rabbit hole. We have a competency. We are a profession, and we have a competency model. And so it is also empowers anyone that is meeting with regulatories or regulatory partners to explain that. These are competencies of our role. These are the practice domains of our role. The other, I think, belief out there, and I'll have Angel comment, is I still think that many might think you have to be a nurse to be an infection preventionist. And I know personally, I have a very eclectic team, very diverse academic backgrounds, that it brings so much more bench strength to the team. And sometimes you have to clarify that during surveys. That's why I go back to following the job description, that make sure your job description requirements reflect the team so that you can, justify that, but also to be able to articulate what our competency model is. And these are the competency of our infection prevention profession. Regardless, there are similar, probably cohorts of degrees or skill sets for it, but it's not just one type of IP that we have. I don't know, Angel, did you want to expand on that perhaps?
Oh, I would love to. Well, you made a lot of great points there, Chris. And I think it is really important to note that as we developed the guide, we were also very strategic in that there are many different backgrounds in terms of education and experience that contribute to infection prevention and that can result in a successful career in infection prevention. We don't clarify anywhere in the guide that you have to have a certain or specific background, or that you have to be an RN or have to have a certain educational degree. It is quite varying, and we're seeing that increase as we look at, you mentioned the APIC mega survey. We're seeing increasing variety of backgrounds in the role. And we wanted to be cognizant and make sure that that was outlined. It's really around the knowledge and skills and behaviors that are needed for successful practice. And many different backgrounds can have those. And then the competency advancement, again, doesn't require any one type of background, but growing in each of those competency domains as you learn and expand in your career. So it's really anybody can be successful as an IP if you follow the tools and resources outlined in this guide. I think it's important to note this competency white paper in conjunction with the APIC IP competency model, regulatory requirements. There's so much out there that provide the structure, the expectations for IPs, But Lerenza, like you noted, it's important for the infection preventionists themselves to take ownership of that growth and development. And the guide is really how we can do that. It gives everyone the tools needed to implement that growth and development. And I really think until the guide was released, that's what was missing. Is how that can be done. So all of these components come together really well to support our infection preventionists in their career stages and their career paths.
Oh, yes, I agree. I think that if we keep talking about it, that hiring practices will change. I think that, we have been having this conversation for years, and I think it's important to keep having it. And then the development of tools like this is extremely powerful in really laying out a framework for an individual who is a lifelong learner and a path for them to grow professionally. So you really talked a lot about the career ladder within the guide, and then even touched on how a lone IP that maybe works for an organization that doesn't have this type of structure could use the guide. Could you expand on that a little bit more? And then maybe touch on, in the guide, I noticed there's a reference to career stages as well as career ladders. Is that the same thing? And how do we differentiate those two things?
I think what would be a great place to start is just outlining how an IP might use the tools and resources in the guide. So for me, I would start with reviewing the career stage descriptions, reading through what those outline, and figuring out kind of where I believe I fit in a career stage. Do I fit within the novice and becoming proficient career stage? Where do I feel I'm currently at in those career stages? And then using the competency assessments and perhaps the other self-assessments that APIC has to really review where I currently am in each of those competency domains, where I have maybe opportunities for improvement, and then maybe where I'm doing really well in those competencies. And once I complete those competency assessments, I would look at where I have opportunities to improve. And then I would use the professional development plan that's in the guide to outline how I can improve in those competency domains that maybe I'm not as strong in. Lay out a plan. And maybe some of those are short-term plans, something I'm going to do in the next 3 to 6 to 12 months, perhaps. Some of them might be longer-term plans. Maybe I have a 3-year longer-term goal, and I'm going to lay out, what I'm going to do every year to get there as well. And then you would use the professional portfolio resource to show how I'm accomplishing that professional development plan. What have I done that I've completed, that I laid out in that plan, and how did I assess my competency? And then again, completing those competency assessments as time goes on and including them in that portfolio to show how I'm growing and how I'm meeting my goals short term to get to those longer term plans.
Just real quickly, I want to add on, Angel's really thorough explanation of it, that what a tool, how it supports, this journey. I think also in our field in infection prevention, when you think of career paths, in the guide, I think we actually call it choose your own adventure. A career path can also, maybe you can step out a little bit or move sideways or maybe to the right or to the left. So maybe it gives the flexibility that maybe you're in your current role. You don't want to leave your role. There's nowhere really to go because infection preventionist, there's only so many job titles in the job architecture, right? When you look at a career ladder, there's only so many places or roles to take sometimes. Career paths is also maybe what we're starting to see in our field are surveillance dedicated IPs. Or we're starting to see outpatient areas. Maybe you're absorbing home health or hospice, or maybe clinics. Sometimes think of those as career paths that maybe you're in a certain setting But by your own inventory of your career, you might think, I would like to be challenged a little bit. Or is any help that they need at the corporate level? Is there a project I could take? I would like to learn how to do project management. Or I would like to develop maybe a surveillance system. Or maybe infection prevention needs some assistance in home health. Maybe they need some consultation. So think of it that way too. And there's a great visual in our guide. It's almost like a game board, if you will, because there's so much work for infection preventionists and our scope has increased so much that I do believe that you can also, in your current role, sidestep into building your skill set in here, if you will. Maybe what we used to call stretch assignments. I don't know. But I think there's some creativity that could be deployed there.
I love that. I love the choose your own adventure. I think that is so powerful. And then it also helps, if you feel like you're stagnating in your place, I've been here, I've been doing the same thing, and then we tip into burnout. But if you can use this guide to see, oh my gosh, there's still so much to learn, and dig into something that you're passionate about, I think that really helps enhance your happiness at work. And then you can use this guide as your portfolio then to take to your leadership and say, see how I've grown, see what I've accomplished. And I think that can also be a valuable tool.
Definitely. And, of course, we're having this conversation, that the IP should be empowered utilizing these tools to really manage and navigate this career path, right? And then also using tools such as the self-assessment and, self-evaluation tools to assess where they are now and where they subsequently should be. But I really would love to hear, Angel and Chris, from your perspective. Because, many of us may have never taken a self-assessment tool, may not really know how to leverage such resources to advocate for maybe growth within our career, right? Because many of us have different paths or careers currently and all of us still can use these resources. So say, for example, you may have a loan IP and it may not be an area of opportunity in changing their title. Or, you may have someone who's working in a large health system and there's kind of challenges with growing within their particular profession, or even maybe a manager that seeks to transcend that managerial role and go into the executive level. How exactly can they use the evaluation tool, to really expand their career functions and navigate this career path?
I think there are so many opportunities, like we've said, for the IPs to assess where they're at and maybe where they want to be as they, quote, choose their own adventure and move forward in their advancement. The competency assessments, the self-assessments are great tools just to figure out where you might have strengths and where you might have opportunities and where you might have growing interest. So maybe right now in your role, you don't do a lot of data management or analysis, but you really like that. So perhaps as you complete the competency assessment, you identify that as an opportunity for yourself to grow. And then you can find individuals either within your organization or perhaps within your APIC chapter or other colleagues you might know to better understand how they use data analysis tools and create better, visuals of data to present to others, just to help you advance in that. Perhaps there's some additional training opportunities that APIC might offer or micro learning lessons. Find those opportunities and those people that can help you develop in that skill set to, in fact, grow in your knowledge base. And then take that back to your organization and share some of that learning and provide some examples of how you might be able to change things that you've previously done to just help others understand IP data. So that's just one example. Chris, what are some others that you might share?
No, I think that those are great. And, the tools, sometimes you don't know what you don't know, or yourself, you're assessing yourself, but what are you assessing yourself against? So I feel like the guide is the standard. It's, so you look at the tools and perhaps maybe you want to, self-assess whatever career stage that you're in just to see. That's kind of the litmus test. So it is the standard. So you're comparing yourself to the competency in the domains of practice for that stage that you're in. So you can leverage that. So maybe you hit them all, but there might be other areas of interest, or like I said, you can look ahead. Maybe I do have an interest in leadership, or maybe I desire to have an abstract at APIC, or I desire to learn more about supply chain. And I say that because I'm at least noticing in my organization on product sustainability, more and more they're pulling IP in on consultative on some of the changes we're making in supplies, just even changing the paper towels, IP consult. So when you think about that, I think our scope of a role is somewhat increasing, but maybe there's committees you want to be on. Being a consultant sometimes in your organization can be a little intimidating, but you can take that on. And the last thing I'll mention is that I always advocate for our APIC chapters, our local chapters. Those are great networking avenues, and it's a great place maybe to practice a presentation. It's a safe place. You're amongst peers. Maybe bring a clinical problem forward, or, hey, I want to try out this presentation. Or do you think that this would be a good idea for an abstract at APIC? So I really can't underestimate also trying new skills or having partners. Sometimes there's collaborative projects in your region through APIC chapters. So I do think there's so many avenues to take this. So while you're using the tools, just to kind of get a benchmark where you're at, there might just be some development or stretch assignment you want in those areas. And there's just so many avenues to pursue those. There are no rules, really.
I think that's a great point, Chris. Even if you don't have opportunities within your organization, there are so many opportunities for IPs in our local APIC chapters and national APICs. So don't let anything dissuade you from, reaching for, increasing your experience within your chapter. You can be a leader in your chapter. You can be a leader at national APIC and the different committees and task forces. So many opportunities for people to grow and develop in this career.
Absolutely. And I think that, I appreciate you for sharing that note that using the self-evaluation tool, you can also assess where you have a growing interest. And why I pull that out is because sometimes based on maybe the sheer structure of your role within a respective organization, or you work at a small rural, institution, or, it just depends on what the focus of your role is and what your job description entails. It may differ, from, region to region or however. But all in all, utilizing this tool, you can see how expansive the field of IP is, because sometimes you may not have that sense of a view when you have maybe you have some limitations within your role and your sense of authority within your respective organization.
Good point, Lerenza. And I think that it's also a valuable tool that you can share with leadership to gain traction in that conversation as well. I think if we, as an infection preventionist coming into the field, if you can begin with the end in mind about what are your career goals, where do you want to be in 10 years or 20 years? Do you want to be a fellow of APIC? Do you want to have the advanced leadership certification? And it's really nice to use this professional development tool to build your portfolio, to understand, in order to reach those types of certifications or that fellow and to qualify for it, you're going to need some criteria that you meet. And that can also help direct your practice if you want to present an abstract at a national conference or publish a paper. Then you can check that off of, okay, now I meet this element towards, the next step that I wanted to achieve for my, advanced leadership or my fellow of APIC. So I think it's a really helpful portfolio tool that I wish I would have had, 10 years ago, so that I could use that as a stepping stool. And then when I'm asked to present that evidence to gain those types of certifications, it's right there for me. Cut, paste, and I don't have to, think so critically about, wait, how did I do this? When did I do that? So it's a really good organizational tool, for professional growth. So, were there any challenges that y'all faced as a committee when you were developing this career advancement guide?
I will say challenges. It was a good challenge. I have to say, it's such a good product. And I hope the uptick continues to increase. I know Angel and I, we do speak to chapters, we try to publicize it. It is well thought out, lots of discernment to get this product to the table for implementation. And the challenges where there were so many discussions, and we met a lot. I mean, we were meeting weekly for a while there. Remember, Angel?
Oh, yeah.
and one of the hardest parts was the infographics, because theoretically, I mean, you kind of all, the group has to land in the same spot mentally, right? Is this what we mean? Is this competency level for this domain, for this stage? Does it make sense? Do we all agree? Once you summit that hill, you want to make sure your infographics support the document or the thought behind that approach. So I think the entire process was a challenge. It was a good challenge. And I want to convey to all of our colleagues, boy, we did the very, very, very best we could and we knew how to do. And I do think the infographics was another piece of that challenge, because we wanted to make sure it accurately represented that thought behind it. I don't know, Angel, if you wanted to add anything during this process.
Yeah. Like you said, it was a good challenge, especially trying to be forward thinking. We know the IP profession has changed so much in recent years, and it's going to keep changing and growing and advancing. So were we forward thinking enough? We already know that there's been changes since the guide came out, namely the Advanced Leadership Certification in Infection Prevention. So that's something that we'll want to, circle back and add in. But I think that was kind of a key piece. We're thinking about beyond the current scope of IP. Where is it going? Where is it growing? And how can we be forward thinking to be inclusive of the future of the profession? And that is a challenge, but a good challenge that we embraced and like Chris said, did the best we could, knowing that that's okay. We'll see updates to it in the future, and that's all right.
And we had to land the plane.
Right.
Absolutely. So I wanted to inquire and pick your brains about this particular scenario, because in our profession, our role is unique in that, innately within our role as an IP, we are leaders, right? That's within our competency model. But of course, many that aren't well versed in our field do not understand that, because typically IPs, in some roles, capacities, they're not people leaders. So it's like, how do you leverage or market those skills? And if you have the desire to transcend into a leadership role, how do you market that? And then, subsequently secure that leadership role if that's your goal within your career. That's my question, is how can we utilize these tools to leverage that if we're not a people leader? But then secondly, for those, of course, there are many people that don't have the desire to be a people leader, but they do want to advance within, their IP career. So they're with that also, how can they use these guides and the white paper to advance their career as well?
Yeah, I think the influential leadership role is probably the hardest component of leadership, because you're right, it's not a defined leadership role, but we all know that infection preventionists are leaders. We're influential leaders. We have to lead our program and lead the work efforts and the sustainment. I'm really hoping that having that outlined in the guide, in the career stage descriptions and the competency assessments will allow people to show their organization that, yes, an IP is a leader, regardless of being a titled leader or a people leader. We have leadership competencies that we need to advance in, that we need to meet, and that we need to use. And by having that included in this guide, others can see that and can understand it. But then we as IPs can also use it to grow in those skills as well. Because you're right, not every IP wants to be a people leader, and that is okay. You still have to grow and develop in those influential leadership competencies, though, to be successful as you advance in your career. I'm not sure if I answered all of your question, but I definitely want Chris to jump in there and add information too.
No, I mean, that was excellent. And, at the end of the day, too, on the flip side, I guess, we all have a role or job or swim lane. And hopefully your role or your job provides fulfillment and you are challenged. Nobody wants to be doing the same thing every day, on and on and on, right? So you do want to grow. You want to take challenges. So I think the tools help leverage that, because everybody has a one-up. And having those discussions that, gosh, I'm really getting bored. I really, I am functioning at this level. This is really the criteria of the role as it's outlined by our industry competency model. I really need some challenges. I think sometimes you also have to make a decision that, maybe I need to pursue looking at a different role. And I think it's okay to have like those discussions like, boy, I am getting bored. Is there any other assignments? Or can I assist with another big project? Or maybe I want to be a people leader. Can I shadow somebody? So I think the tools, again, help you land to what your current state is and understanding that. And then really, is the job ideal for you? Is there opportunity to try or experiment with something else to support that journey? Because we all get a little bit restless and sometimes we want to change it up. So I think using those tools is your reference point. And then you can, again, create your own adventure and whatever that may look like. Maybe you want to stay in the same job, but there's opportunity to work on some committees, maybe at the corporate level, or really work with other teams on maybe some exciting projects. I think you have to have those open dialogues, but the tools can leverage that because it's really an objective assessment to where you're at and where you want to go.
Oh, this has been so wonderful, Chris and Angel. You guys have created such a pivotal tool for individuals in our profession and an important framework for us to follow and to build upon in the future. So the profession is really benefiting from your passion, and I'm grateful for you both for joining us today. Thank you so much.
Thank you.
Well, thank you so much for having us and letting us share more about the guide.
Absolutely. Thank you. It's been a pleasure having you, Angel, and Chris on the show. I do want to implore listeners to definitely check out the website, 5secondruleshow.org, the number 5, just to reference the IP Career Development and Advancement Guide, along with the Competency White Paper, which will be under the resources, episode 4 of this show. Thank you.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.